You are try to record it.
Yes, I've just started recording.
Okay.
Okay. Yes. Hello, doctor.
Uh, Hello, good morning, Mr. Smith. Nice to see you. I'm Dr. How can I help you today?
Okay, I'm fine, doctor. Yeah, I've had this problem in my chest. It's this burning sensation,
Oh,
started a few months ago, maybe
uh-huh,
by even 6, 7 months, I don't know. And it's worse when I lie down.
uh-huh.
I also have some kind of burning sensation and a bad taste in my mouth. Sometimes feeling something sour coming to my throat. Sometimes I
Okay.
cough like that. When I want to speak, I have to clear my throat, and sometimes I cough.
Uh-huh.
A friend of mine said it's stomach. I took some antacids and it didn't work really.
Oh,
Um, yes, and my father died last year, and he had a heart attack. So
oh, I'm sorry.
um, and it was something similar to this. He had the same problem. So I thought maybe it is my heart. So that's why I'm here today.
Okay, okay. I'm so sorry to hear that. It must be you have a tough time, and I appreciated your concern. But let me ask some more questions.
Okay.
You said that your symptoms started from 6 to 7 months ago.
Yes, it's been on and off at first, but then it is getting
Uh-huh.
worse, and yeah, so that's why I thought maybe, and I tried antacids, it didn't work, so um,
Okay.
uh, it doesn't seem
Okay.
to be my stomach anymore.
And you say you tell me you told me that you try to use other medications, but they didn't work.
No,
Yes,
yes, that's right.
and you have your these symptoms when you are lying only. Yes.
No, no, it's all the time, but it's worse when I'm lying down. The pain is worse when I
Aha,
lie
the
down.
pain. Okay, okay. And can you rate the pain on the scale rate from 0 to 10? 0 is the best and 10 to the worst.
Well, it's always a 3 or 4 there, but when I lie down, it might be 6.
Okay. And let me see if I can remember everything. You have bad symptoms, heart burning or something like that, around 4, 6, or 7, 8 months ago, and you feel that maybe these symptoms related to your heart. Is that correct?
Yes, that's right. Yes.
And your today you came here and for requesting a heart assessment. Is that correct?
Yes. Yeah. I think. Yeah. Because I'm convinced it is not my stomach anymore. I think it's just might be my heart.
Oh, and today you are hoping that we run a heart test for you.
Is
Is
it
that correct?
possible? Yeah.
Uh, Let me explain you. As given what you said to me, it is most likely is a common condition, is completely related to your your stomach, not heart. It's
Mm.
completely related when your gastric juice has excess in during the esophagus. You experience this kind of symptom you have. Is it
Mm.
okay?
Okay. So
Uh,
yeah. So you mean it's the acid, but it's not my heart.
exactly. Let me reassure you, it is important that all of symptoms completely adjusted with the pattern of reflux of your acid from the stomach to the esophagus, and it's not related to heart at all.
Okay.
Is it okay?
Yeah, but I mean, is it possible to run any test at all? Because I have this family history. My father had this problem.
Okay, I completely I understand your concerns, and I'm so sorry about your father's, but there is no benefit for you for doing assessment for your heart. In fact, it maybe you lost the golden time for getting the proper management for your condition. And in my opinion, it's better to it is important that you are now focusing on your stomach condition and try to get an appropriate treatment approach and treatment for this. Is it okay?
Okay.
Okay, and now let me explain you the steps for approaching of this. First of all, we need to run an endoscopy. Okay.
I don't like that really. It means putting a tube down. I'm really scared. I can't do that.
I understand. I understand and appreciate your concern. And I have a few patients that think as you, thinking as you, but it is important to do that because the endoscopy gives us an opportunity to take a look carefully inside of your esophagus, and we can now to know that exactly what's happened in this, and we are sure that there is no any sign, there will be no any sign of symptom, no any evidence about the abnormal growth during this. But maybe sometimes we need a conscious sedation, and if you and for at this condition
Right.
you don't feel anything. Do you think you can manage it?
Yes, okay.
Okay,
If you say so.
and after that, we try to pH monitoring for confirm the diagnosis and severe and determine your severity condition. And after that, we can give you a appropriate treatment. Is it
Okay.
okay?
Okay.
Okay. Is there anything else?
No, that's it, doctor.
Okay.
Thank you.
I will arrange an appointment for endoscopy for you. Bye.
Bye. Push نکردم دیگه. Okay. Right. How does that feel?
این دفعه خیلی خوب بود.
Okay. Good.
ده جرأت نمیکنم بگم، ولی خب خیلی بهتر از قبل بود احساس
Okay.
من.
9 or 10?
10 خیلی زیادیه.
Okay.
9 بهتره.
Okay. So, what went well? Okay. What was done well?
I try to react to patient.
Okay. So it was a structured. You had good rapport, information gathering, and exploring eyes, reacting to patients. Good. And information giving. Okay. So you did most of these, but how about you introduced yourself? You said my name is Dr.
Yes.
Okay. You said hi, Mr. Smith. My name is Dr. So how is it that you know him but he doesn't know you?
I think that he doesn't know me.
Why? It's general practice. You
But
know
in the
his name.
general practice, there are different doctors, no?
No. You're not supposed to. No, it's in general practice. You're supposed to be the same person. Okay. Anyway, but if you introduce yourself, you need to ask the name. But yeah, obviously, okay. that's fine. I just thought it's probably not usual to know their name, but then to introduce yourself. But you can argue that, well, I see their name in the computer system, and then I introduce myself.
Okay.
Right. But okay. So, in which part do you think you could do anything differently?
Uh, I try to information giving. I try to do different with, before, because I think that is the weakest point of me. Information giving.
Giving. Okay. Right. I think there's something to do with your structure, really. You
Yes.
know, uh, it's when you find out the ice, you start to summarize again from the beginning. You said that, well, you have had this stomach problem for 6, 7 months, and then you think that this might be related to your heart. Okay, so you can
Yes.
chunk it here. You can say, okay, so basically you're here because of this stomach problem or your chest problem, which has been 6 months. Is that correct? Yes, that's correct.
Uh-huh. I
Okay, so you chunk it there. So
okay.
when you're summarizing and chunking uh, at I, at C, and at E, if you have them. Okay. So
Yeah.
you're here because of your chest problem is for 6 months. Is that correct? Yes, that's correct. And you're concerned because you think it might be related to your heart. Is that right? Yes. And you're here to check for your to check your heart today. Is that correct? Yes, that's correct. Okay. And now, uh, so before you go and explain about endoscopy and all that, you actually need to address this. You need to address this expectation. So at first, you need to say, well, this is nothing. This is not something that you need to. So you need to be convincing. Uh, you actually passed through that very quickly. Okay. So regardless of what it says in the case note, this is what you need to do. Okay. So you need to say, okay, uh, so your questions need to, when you're asking questions, you need to exclude or rule out heart disease. Okay.
بله.
So what questions do you ask when you want to see if someone has heart disease?
In the heart disease, chest pain is go and come, and is have continuity, shortening the period between the pain in the chest, and there is no positional chest pain.
Mhm.
But the patient mentioned that has a severe chest pain when lying.
Okay, good. So basically, you need some details of the chest pain. So that is in information gathering. And the most important point is, okay, does it happen at any particular time? Does it happen with exertion? Does this happen with eating or get better with eating? So, yes, the most important point is actually how it is related to exercise or exertion. And the other thing is how severe you ask. It is 6 or 7, it's 4 or 5, and then it becomes 6 when I lie down. So it has nothing to do with exertion. And then you can say, look, problems with the heart or heart disease causes severe pain, which lasts only a short period of time, and it gets worse with exertion. So basically, what you're describing doesn't fit in the heart disease, and besides, you're too young for that. Okay, and then so when you ask questions, enough questions, you can exclude the expectation. You can say, look, you don't need, actually, it's not necessary. And then what we usually do, remember, hand over the problem back to the patient. Now, okay, now you say, okay, it is not heart disease, and these are the reasons. Is that okay? No, the patient says, okay. Now, if it's not heart disease, now what can I do? Okay, now is the time to talk about what we can do, the management plan, and that's how to manage the gastroesophageal reflux.
Oh,
Okay,
you mean that we need to describe to the patients your symptom is not heart about heart because 1, 2, 3 reasons, and
that's right.
after that, okay,
After that, so when you get there, that okay, so this is not your heart. Okay, okay, then if it's not my heart, now what is it? It's yeah, it's reflux disease. Okay, what can I do about it? Okay,
okay,
so yeah, it's a tricky case, but in fact, no, the first thing we do is we check the eyes and respond to it. Okay.
okay,
Now, what is tricky here is that there are two ices here. Okay, the first ice was I'm concerned about the pain might be heart disease, and my expectation is that to check it. But later, when you say it is not, then the ice changes. The new ice, okay, and that's how it is tricky. The new ice. What is the new ice now?
is
Okay.
about endoscopy.
Yep. So the new one is okay. You said your idea is that it is GERD. Okay. The concern, okay, is it bad? And expectation uh,
Doing
is
endoscopy.
to treat it, okay, or to manage it. How to manage it? And you said that you respond to that, and you say yes, it is not heart, it is GERD. It can be bad, but we wouldn't know now. And what we can do is to send you for an endoscopy, okay? And so that's the new ice. So the first ice was heart disease. The second ice is GERD, okay?
Okay,
And that's why it is a tricky consultation. Uh, Okay, so sometimes the agenda changes. So that's the how it works basically. So you need to identify and say, okay, now no, it is not your heart. Okay, now what do you want to do? Okay, if it's not the heart, now so what can I do? Now I'm here, just do something. Okay.
okay.
So basically, you say it is not heart. It's not your heart. It is your stomach. Now, uh, what do you think? And then the patient starts asking question. Okay, yes. Is what can we do now? Okay, we need to do some tests to find out or to establish if it is and how bad it is, and then to treat it. Okay. Uh, we use the word gullet for uh, esophagus. People don't say esophagus, okay? They say gullet.
Aha, got it.
Uh, okay. Hey, we don't need to ask the patient, let me ask you some more questions. Why do you say that?
Oh, don't necessary for this.
It's not necessary. Just say,
I
okay,
think that maybe is a kind of signposting, no?
uh, yeah, but you don't need signposting in when you're asking questions.
Okay.
Okay. We use signposting when we are changing the direction. So you're asking question and then you say, okay, let me ask you more questions. Well, you don't need that. Just ask more questions.
Okay. I know.
Okay.
Nice.
But when you are explaining and then you want to ask questions, then you need to say, okay, now let me ask you some more questions. Okay.
Yes.
Right. Or you can say, oh, I forgot to ask you a question. Well, okay. So, for example, you're summarizing. Then you remember you forgot something. You say, okay, so this is what you say. This is your idea. This is your consent. This is your expectation. Oh, I forgot to ask you something. And this is a signpost. I forgot to ask you something. Um, uh, how old was your father? Okay.
Okay, I know that. Thank you.